Hello everyone, welcome to our stressor and trauma-related disorders video in our psychiatry chapter. My name is Zoya Morani and I'll be lecturing you through this video today. So what are stressor and trauma-related disorders? These are psychiatric disorders following a traumatic or stressful event. So main thing that's different between these psychiatric disorders and others is that a presence of a trigger event is necessary. Some of the stressor and trauma-related disorders we'll be talking about today are acute stress disorder, PTSD, adjustment disorder, generalized anxiety disorder, major depressive disorder, and grief. You will be able to differentiate these based on symptoms, triggers, features, and duration of symptoms. I really want you to keep in mind, however, that sometimes there's only one thing that you can base your differentiation off of, and most of the time in question vignettes that'll be your duration of symptoms. So pay special attention to that. The first two disorders we'll be talking about are acute stress disorder and PTSD. The reason I've grouped these together is because their symptoms and features are similar, but the only differentiating factor is the duration of symptoms. As I've mentioned previously, sometimes this is the only differentiating factor you will have when diagnosing the patient. Especially in the question vignette, they might sound very familiar. They might give you both the options, but you have to pay particular attention to the duration of symptoms. Now, both acute stress disorder and PTSD present with anxiety and distress, and this is usually after a trigger, such as a specific traumatic event. This could be a patient that was a veteran, has gone to war, seen something traumatic, experienced something traumatic, and now they're having all these symptoms. Some of the features to keep in mind are intrusion symptoms, negative emotions in response to the experienced trauma, such as fear, guilt, shame, avoidance coping strategies, so they're trying to divert their mind from this whole situation, and they also present with altered reactivity. To go into more detail, the DSM-5 criteria for acute stress disorder is exposure to death, injury, or sexual abuse, and it has to occur in one or more of the following. So it is not necessary for a person to just have a direct experience. That is one of the criteria. However, a person could also be witnessing this traumatic event, hearing about it happen to somebody close to them, or having repeated exposure to unpleasant details of the traumatic event happening to others. And they will present with at least 9 of the 14 symptoms. Now, these 14 symptoms have been grouped into 5 different categories. You have intrusion, negative mood, dissociation, avoidance, and arousal. Keep in mind that for acute stress disorder, which occurs within a month, 3 to 30 days, the first-line treatment is not medication. It is cognitive behavioral therapy, and pharmacotherapy is not indicated. Benzodiazepines can be given to reduce agitation or disturbances. However, keep in mind if the patient has a history of substance abuse, you do not give benzos. PTSD's DSM-5 is very similar. It's actually almost the same. Again, the only difference is duration, lasting more than 1 month. In order for you to diagnose somebody with PTSD, you will have to rule out other medical conditions. The first-line treatment is psychotherapy, but in this one you may or may not use pharmacotherapy. And when you say pharmacotherapy, this can be SSRIs, SNRIs, or other medications. A good mnemonic I like to keep in mind for PTSD is trauma, traumatic event, re-exposure, avoidance, unable to function, more than a month of duration, and arousal is increased. So the 2 M's are for more than a month. And this will help you remember that PTSD is more than a month. So here are some clinical features I'd like you to go over to be familiarized with PTSD. These patients have an exposure to life-threatening trauma or something that they may have witnessed, not necessarily them going through it themselves. The duration of the symptoms are 1 or more months. These include sleep disturbances, irritability, hypervigilance, emotional detachment, decreased interest in activities, avoidance to reminders, amnesia for the event. Sorry, there's a typo here. Negative mood, flashbacks, intrusive memories, and nightmares. So, these are some of the main ones to keep in mind. And again, they have negative mood. They try to avoid reminders. Sometimes they may have amnesia for the event. They'll completely deny even remembering it. Adjustment disorder is when patients have distress disproportionate to the expected response to the trigger. The triggers can be identifiable intrinsic or extrinsic stressors. The key word to keep in mind here is that their distress is disproportionate. Okay, so emotional and behavioral responses are disproportionate to the scale of the stressor. So when certain individuals go through certain things, there are stressors, and they have a certain reaction to them, these patients will have an exaggerated response to that, and it would look and seem disproportionate to what it should be. This is within 3 months of onset of the stressor, and it should last 6 or less months following termination of the stressor. The DSM-5 criteria in order to diagnose adjustment disorder is that the patient should have emotions or behaviors in response to the stressor within 3 months of the onset. If the symptoms start, 5 months later, then that's not considered adjustment disorder anymore. The stressor could be anything like moving to a completely new city, changing jobs, or some change in life. Clinical significant responses include one or more of the following. So the person can have either a disproportionate distress to the stressor, or keep in mind they could also have impaired functioning. When you talk about impaired functioning, is that they're no longer able to function normally as they used to in their social gatherings or social settings, or they're not able to function appropriately in their occupational settings. So the question vignette might explain somebody that has been recently fired from their job due to inability to function appropriately anymore. First line for adjustment disorder is cognitive behavioral therapy. It's not pharmacotherapy. You can do CBT or you can do psychodynamic psychotherapy. You can also introduce individual, family, or group support therapy, interpersonal psychotherapy, and lastly, you can introduce pharmacotherapy if needed. Major depressive disorder is consistent depressed mood and/or anhedonia. Anhedonia is the inability to feel pleasure. Triggers could be psychosocial or environmental factors. This could be major life changes, abuse, serious illness. People with terminal illnesses also can present with this. These features include, but are not limited to, impaired memory, sleep disturbance, feelings of guilt, weight changes, suicidal ideations. Keep in mind duration is 2 or more weeks. To diagnose major depressive disorder, your patient should have 2 or more weeks of the 5 or more of the 9 symptoms. This includes depressed mood and the psychic HAPS mnemonic, which I would like you guys to memorize. This includes sleep disturbances, loss of interest, excessive guilt, low energy, impaired concentration, appetite disturbance, psychomotor retardation, agitation, and suicidal ideation. So to assess and diagnose your patient with MDD, you would want to interview them in the clinic, have a mental status examination done, provide suicide risk assessment, and rule out other conditions with lab test history and physical examination. Keep in mind there are other conditions which may look like major depressive disorder, but they are not. An example could be vitamin D deficiency. People with vitamin D deficiency may present with low mood, and that is a good differential diagnosis to keep in mind. The first line and the best treatment for MDD is SSRIs. Now this in combination with CBD has been proven to work the best for the patients. If your patients are not reacting well to the SSRIs, you can do an SNRI or other antidepressants instead. I've created this little table to help you compare between the different depressed mood disorders in comparison to normal stress response as well. With normal stress response, keep in mind functional impairment is not significant and the severity is not out of proportion of the compared stressor. When we discussed adjustment disorder, there's a typo here. So when we discussed adjustment disorder, remember that the severity and proportion of the reaction was disproportionate to the stressor itself, and there was significant functional impairment and/or distress. The onset is within 3 months of stressor, remember no longer than 6 months of termination of stressor. Major depressive disorder, which we just discussed, again, 5 or more of the 9 symptoms, depressed mood and SIGA caps, which you should memorize, and this should last 2 or more weeks. You have to make sure there's no history of mania, otherwise this goes into bipolar disorder or something else. And functional impairment is usually significant in MDD as well. Something we didn't discuss is dysthymia. Now, dysthymia is usually major depressive disorder symptoms that last 2 or more years. So this is 2 or more years of chronic depressed mood. This is when you can start to think about dysthymia. Generalized anxiety disorder includes 1 or more of the following symptoms. These include fatigue, difficulty concentrating, muscle tension, sleep disturbance, irritability, restlessness, feeling on edge all the time, uncontrollable and excessive worrying for 6 or more months. So keep this timeline in mind. These patients like to be perfectionists. They can present with headaches and stomach aches because they have this unsettling feeling all the time. The triggers are non-specific events or themes. This could be just a general feeling of anxiety, and different things can trigger these patients. Treatment, first line for generalized anxiety disorder is cognitive behavioral therapy. You can also give these patients SSRIs or SNRIs. Again, duration is 6 or more months. Some of the differentials you can think about are OCD, with their compulsive behavior and intrusive thinking, social anxiety disorder, separation anxiety disorder, and adjustment disorder. Now, OCD, social anxiety disorder, and separation anxiety disorder are not stressor and trauma-related disorders. The only other one that we've discussed so far is adjustment disorder, so do keep that in mind as well. Lastly, we have grief. Now, grief is a normal response to losing a loved one as long as it's within 12 months. So keep this timeline in mind as well when you're going through question vignettes that explain these symptoms. So patients with grief, they feel pain and grief mixed with positive memories and feelings for the loved ones. The reason we're also discussing this is because grief can be very similar to major depressive disorder in the sense that they experience intense sadness, insomnia, weight loss, and poor appetite. But keep in mind, patients with grief, which is a normal response, they have intact positive memories and they lack other depressive symptoms. So a patient going through normal grief would not feel hopelessness, they would not have low self-worth, they would not feel guilt, they would not have suicidal ideation, and they would not have anhedonia, which again is the inability to feel pleasure. Grief can become complicated if it's prolonged. Now, for example, if a patient is having all these symptoms beyond 12 months, this is now known as complicated grief, also known as persistent complex bereavement disorder. Again, this is prolonged grief. The patient has excessive yearning for the disease and inability to move forward with life. That is all for my video, guys. I hope this helps you with your exams. This is my favorite quote: "For indeed with hardship there will be ease." And this has gotten me through my studying, my step 1 journey, and I hope that you keep this in mind while studying for your step exams as well. I know it is a tough journey, but hopefully our PIMG videos help you get through this difficult time and make it easier for you. Good luck, everyone.